I'm just going to share my slides. Hopefully all of you can see them. Okay, so let's get going. So again, welcome. This is the UCL MBA Health Information Session, and I am Professor Nora Colton. I am the director of the Global Business School for Health. Before I get going talking more about our MBA, I'd just like to tell you a little more about the school, why we set it up, and why I'm so passionate about this endeavor. First of all, we are the first school, a business school, I should say, in the world totally dedicated to educating the next generation of health and healthcare managers. And this really is an important task. If you are in the health profession, if you're interested in pivoting into the health profession, all of us realize the impact, not just the pandemic has had on health and healthcare. It's really just raised our awareness of all the issues that actually many of them were there before. Things like inequality, social inequality, and the social determinants of health have always been a huge issue, but more than ever they are today. And we've seen that consequently, even the impact of COVID was not equal. It affected people from lower incomes who have less access to health, both in terms of preventive, diagnostic, and therapeutic, much more so than people who were better off and had other things like better education and better housing and better food and better income. So that's a very important aspect now of health and healthcare. Moreover, we've seen the impact that COVID has had on mental health. That mental health and well-being have again been issues that have been important for long before the pandemic. And then, of course, there's parts of the world where we're seeing lots of aging populations, and that demographic change, that means that there's further demands on the health system. But even in countries with younger demographics, we see that non-communicable diseases, stroke, cancer, diabetes, are all having a huge impact on health systems. So the health sector was already really in need of change, but the pandemic has really accelerated that, not just in trying to find solutions, but really forcing us to really think about reimagining healthcare, about thinking about different health models. We can't go on like we've been. We don't have the labor force. We can't train up enough doctors and nurses and clinicians to really help us all. So health systems are going to continue to change regardless where you are in the world at an exponential rate. We're going to need to use more innovation, digitalization. We're going to need to think about more about prevention, about diagnostics, about remote patient monitoring. So all of these things are going to be important things that will really help you focus and ground while you're in the Global Business School of Health. So we have created a business school where people like yourself will come, congregate, and really make a difference. Learn to be the change makers. Learn to be those who can rethink and come up with new pathways, new models for really addressing the health needs within society. And that really is our passion. We really want to bring about a difference in this sector for everyone. So why do a UCL MBA in health versus a general MBA? I just was on a call earlier today with a student, prospective student, who was asking me this exact question. It's a really important question. I get it both ways. I get some students who are concerned that if they do an MBA in health, they won't get the breadth that they'd get in an MBA, a general MBA. And then I get other students who are really looking for the depth. They want something that really sets them apart. I love this quote by the former dean of the Harvard Business School, Kim Clark. Medicine and business have long been intertwined, but today, with the extraordinary promise of emerging medical technologies, sweeping change in delivery of healthcare, and the push to control the costs of medication, the need for leaders firmly grounded in both fields has never been greater. Absolutely. And that is what this program is about. The health sector cannot be seen in a vacuum. And the business side of health and healthcare management could not be more important. As I was just saying a minute ago, thinking about all the determinants of health and how society's changing, and all of this requires managers, leaders, people who can really think out of the box, who can really understand the business management side, but contextualize it within health systems. And again, why is that important? Well, wherever you're sitting right now in the world, you'll know that health systems differ significantly. They don't just differ on who's the payer, who's the provider. They differ in terms of values and how they're integrated into societies, the way we look at them, the things that we're willing to tolerate, those who are included and excluded, those, there are parts of the world where, people, pay disproportionate amount of their income to receive health care. It's not considered a public good. And then we have other societies where it's very firmly seen as a public good. So it really takes contextualizing and thinking and understanding those comparative health systems and thinking across countries and looking for good practice and recognizing that that good practice can take place anywhere in the world, and that we can learn from really this much more intense study across all the different disciplines within an MBA. So when we think about an MBA, we think about operations, we think about strategy, we think about entrepreneurship, we think about human resource management or organizational psychology. All of these things can be viewed within the context of health and healthcare. So our MBA is really cross-disciplinary with teams of individuals. We don't have a module, a course that's taught by an individual. They're taught by teams, because that's really what it takes to find the solutions that we need in healthcare today. This MBA is not just for medical professionals. It's for people from pharmaceuticals, from biotechnology, from other consultancy, from healthcare organizations, both private and public. This is a place for people who really want to make a difference in health, regardless of their background previous to joining the program. And it offers you everything you would get in an accredited MBA, along with a real specialization, a focus on health. So why even get an MBA? Well, first of all, MBAs are special degrees. I often get students saying to me, what's the difference from an MSc, a master's program, and an MBA? Wow, there's a huge difference. MBAs are really about accelerating your career. They're about, essentially putting 10 years into one. And they really, when you're doing your MBA, it'll feel like that at moments as well. But the reason is it's a real transformational experience. It's about really getting you to shift from thinking about your individual contribution in an organization to managing to others effectively. It's about building your personal and self-confidence. And we do that, we build your self-confidence through using a case study approach. It's used in lots of business schools, and it's highly effective. All the research shows that it really does make a difference. So how does that work? Well, you'll come in and you'll do readings, but you'll prepare cases. These cases are scenarios. They will be, questions. We have a whole bank, as we call it, of cases that you will do during this program. And they're all focused on different aspects of healthcare, contextualized with the business subject that you're studying. And the idea is to get you to simulate lots of information, learn how to, though, make decisions, sometimes with inadequate information, but make positive and confident decisions. And you won't always get it right. And that's part of being in this safe space during your MBA, where you'll come in with your colleagues and you'll share how you went about it. Not just the decision you made, but how did you go about making that decision? It's about those questions that we'll ask you. It's about the challenge that you'll get, as well as support in terms of realizing how to be a good decision maker. And being a good decision maker is often more about asking the right questions than it is with coming with the right answers. So that will help build up your confidence. You'll learn in a very short period of time how to assess a situation, to ask yourself and your colleagues the right questions, to get the right research, to get the right data to support getting an answer so that you can come with a solution. And doing that over and over, it's like any muscle. It will become very natural for you then to be making those kind of decisions. So that's where the transformation takes place. So that when you leave this program and you go back to either a healthcare organization, a hospital, an NGO, management consulting role, you will be able to very confidently look at challenges as opportunities for you to solve, and also be able to identify those challenges as well as solve them. So this is really what getting an MBA is all about. And that is why the case study approach is used pretty much universally in top MBA programs. But the real distinction here is that ours will be focused on health. So what should you expect in your MBA? Well, it's like a boot camp. It's going to be in a very intense, very busy 12 months, and it full on 12 months start to finish. So it will be focused on health care management, but you're going to get loads of business management techniques. You'll get the kind of training, and I'll go over the topics in just a minute. So you'll come out with lots of quantitative as well as qualitative skills in this program, and that will really build up your credentials and your credibility in the workplace. And when should you do an MBA? So this is a big question. I often have people come to me, I would say the best time to do an MBA is early in your career, especially an MBA like this, where you're going to step out for a year, but also in mid-career. People today have lots of careers. It's not a linear journey. So if you're one of those individuals who's really thinking about pivoting or changing or redirecting what you're doing, this is a great program to get involved in. And why UCL? Well, of course, UCL's 8th in the world. It's first in research, but what really stands out is it's truly health, medical, and life science university. So, students will say, well, yeah, but it's the business school. Well, we're a new business school, of course, but I can assure you that, yes, we are part of this fantastic university. And part of this cross-disciplinary learning that you'll get is across our faculty where we sit, which is the Faculty of Population Health, which is rated 5th in the world. And then we're going to be tapping into all sorts of, through these cross-disciplinary teams, our colleagues across UCL. So you will be getting the best that UCL has, and UCL is the best. So what then really stands out? Well, we understand the healthcare sector, and I hope if you haven't gotten that message so far, just do a little homework on UCL, our grand challenges, what difference we're making in the health sector. And remember, this program really brings that all together. And the other thing is, I know that there are other MBAs that claim to do health, but this is a real novel program, I can assure you. We've built health and healthcare into every single aspect of the program. I've seen other programs where they have essentially a general MBA, and they tack a couple modules on the end with health or healthcare, and then you might do a dissertation with a health focus. This is very different. This is all about making sure you get the general management and business skills, but with that health aspect throughout. So regardless if you're studying strategy or if you're studying economics, you will get health, and health will be where the cases are come from, where the conversation lies. And again, I'm going to talk some more about that. We also don't do a traditional dissertation. This really is a professional program. It's about preparing you for your career, for your next step. So our penultimate programs, our capstone programs and exercises and projects are really about taking what you've learned and applying it in a safe space through your degree program and getting that experience that will really help launch you further on into your career. So we have also added into this program lots of extra opportunities. There'll be opportunities to do extra cases with, different scholars. There'll be opportunities for you to have career events. We've got a designated MBA career consultant that will work with you. We also are working with a recruitment agency who will come in at the very beginning of your program, giving you a number of kind of psychometric tests and personality tests and assessments to help you really understand where you start in the program and help you visualize where you want to get at the end. We also have a really exciting program in the school called Health Executives in Residence. It's an opportunity for you to get career advice from CEOs, former CEOs, senior executives in the healthcare space. Every semester, these individuals will offer up office hours virtually. You can sign up for them, and as an MBA student, you can sign up to as many as you want. And it's a great opportunity to get to talk to these really successful individuals, understand their journey, get career advice, think about your own journey as you move forward. And then last but not least, I want to mention the alumni community. And being an alumni doesn't start when you finish your degree. Actually, it starts when you start your degree. So once you're in the program, you're going to be joining a very elite, very special club with those individuals who are on the program with you. Many of them will end up being your lifetime points of contact, networking, and that's why coming to the Global Business School of Health, where you'll have people across the globe on the program with you from lots of different aspects of health, will really help you become part of a very special community. We also have other alumni at UCL, people who have already gone through programs at UCL who are in the health world and who are there to tap into. You'll be a part then of, tens of thousands of alumni scattered across the world that you can network with whenever you need to. And then I also just want to mention that in today's world, you cannot get a degree and just call it quits. So you're going to be a lifelong learner. So we will offer our MBAs a significant discount. Come back, do our executive education, our short courses. You will have so many opportunities, not just when you come for your reunion, to really get to know us and to attend our events and be part of this fabulous school. So what are we looking for? Who's our typical student? Well, again, as I mentioned to you, usually somebody either early or mid-career, but again, if you're later in a career, that's fine too. Has a good academic background or clinical background, and the one bullet point here that's most important to me is ambition and determination. We want people who really want to be change makers, who really want to make a difference, who are excited, who are going to engage this, who are fully going to be engaged in this program and see this as really a life-changing opportunity. That is really important, your motivation for doing the program. It could be that you're looking to build your career in healthcare management, pharmaceutical management, biotechnology, consultancy. You want to work in a hospital, and all of that is really important. And it's really for people who have an eye on it, really accelerating their career. So that's really the kind of individual that we want for this program. So what are some of the career destinations? Well, people often ask me that question. You might want to be a health consultant, and of course, the big four consulting firms, PwC, Deloitte, KPMG, EY, all of these, along with places like McKinsey and Boston Consultants, many of them are hiring more and more people into the health space because they are really required to do more in this space because of the demand. Many hospitals, organizations, they're looking for solutions and they need to step outside their organization to help find those. So consulting is an important avenue you might want to consider. Senior management roles, again, Could be in pharma, biotech, public-private health, and in the WHO, the insurance industry, a place like Bupa or NHS, pharma companies, health tech, med tech. There's so many startups now. And of course, if you're in the medical field, you might want to be in the C-suite there, or a medical director. There are endless opportunities that you can really launch your career into. So this is a really special program. And it's, I'll talk a little more about scholarships. It's £45,000 is the tuition. That's for home or overseas. We do have some really good scholarships. We have scholarships up to £15,000 that you can apply to, which, if you're an overseas student, really brings you down to about the cost of a master's program. If you're taking it full time, as I said, it's a full time 12 months, so every single month, or a part time over 20 months, 24 months. It starts this September 22, and it's a great opportunity. So let me now just walk you through really what the experience is going to be like. So first of all, once you're enrolled into the program, you'll get access to a number of online primer courses. One of them will be on global health. And I'm really excited to tell you that that course is being designed by myself and Mark Brunel, who is a visiting professor. He's also a senior global healthcare consultant for McKinsey, very well known. Has done projects in 80 different countries around the world, and has a great book called In Search of the Perfect Health System. So that is going to be a wonderful course to get you started, help you understand where your colleagues come from. Health systems do literally differ for as many countries as we have in the world. We have probably that many health systems. So you'll also have the opportunity to take a primer in study skills, time management, finance, economic, and accounting, because that's an area that often students come in and really need some support. And then your program will start with a 2-week induction prior to the start. And that's really an opportunity, again, for you to get some self-reflection, set some goals. We also really start the kind of careers and recruitment process with you right from the very beginning. We don't wait till midway through your program. We start right there at the beginning. And so that those personality tests, meeting with the career recruiter will be very important. You'll also, in those first 2 weeks, have a 3-day residential off campus. And that's really to help you build as a cohort, as a team. You'll have opportunities for personal and group development. You'll be placed in your team for your first project that you'll do on this program. So that's a wonderful opportunity. You have lots of speakers coming in and talking to you about just the healthcare landscape, both within the UK and globally. And then you will start your program. Now, before you actually set foot in a classroom, you'll have lots of materials and cases to work through online. You'll have some discussion forums, and then you'll come for your first block. So these blocks ran over 4 weeks. You'll have prepared for each of them beforehand. They usually will have 3 topics that you'll cover. It's kind of like 3 10-week credit courses within one. The first one's called Strategy, People, and Marketing. So you'll have prepared for a week of strategy. What does that mean? That means that you'll come from about 1 o'clock in the afternoon till 6 in the evening, 5 days that week. So that's 25 hours of learning that you'll do that week. It's very intense, but it'll be a fantastic experience. And at the end of that, you'll have a real strong background in strategy and strategic thinking. Then you'll go into the next week. It's human resources and organizational behavior. Again, you'll have a week of that, a week of marketing, and then you're going to have your final week, and that's called wrap-up week. And that is where we bring in health professionals to come in, pull it all together, pull those various strands together, talk to you about the work they're doing in these areas, have interactive activities, and finish off your assessment. Then you'll have 2 weeks to prepare for the next block. Again, you'll do readings and cases and prepare those for the in-person sessions. You'll come, the next group is, the first one will be accounting and financial records, corporate finance, policies and practices for healthcare, and then you'll have a wrap-up week. Then you'll do your final assessments for term 1, and then you'll have your Christmas break. You'll come back in term 2. Your first block will be data-driven management. In that one, you will cover economics and health economics, data analytics and visualizing with data. You'll also have sustainability in healthcare, and then a wrap-up week. And then your fourth and final week, you'll have a choice to pick some different topics for the various weeks. So those can be things from digital health and innovation, systems leadership, design thinking for healthcare. You'll have a range of courses, change management, for healthcare. You'll get to pick from these various topics, and then you'll have a wrap-up week. Now, there's 2 big projects that you're going to do alongside everything else. The first one I'm really excited about. That's the Global Health Challenge. So when I told you you'll have this induction, and it will be quite intense, you'll have also the opportunity during your induction. You'll be put into a team, and those teams are going to be really important because you're going to start from the very beginning working on a project in a lower middle income country. So we've got a number of academics in the faculty population health. They have many projects. Some of the countries we're looking at now is Nigeria, India, and a location in the Middle East. You'll work on a project with the academics to find a solution to a problem, a health problem. You'll also be working with industry mentors. And either in January or possibly in May, you will travel out there for 2 weeks to have a field experience. You'll learn much more about the health system. You'll conduct primary research for your project. And then you'll have workshops and be meeting with your team across the year. And in term 3, you'll finish up writing up this project, which should culminate in a research project paper and a presentation. So it's a fantastic experience to really see what it's like to be a global consultant working on a global project. The other part of your final assessment is what we call the Health Consultant Project. And again, we are working with a number of companies, firms, and organizations to draw up, and these include hospitals, NGOs, briefs that are for consultancy briefs. So this is really your opportunity to be a consultant. You may work by yourself or in a small team, depending on the project that you're assigned. How we will put you on that is really based on your interest. So if you're interested in going into an NGO, we'll try to source a project for you in an NGO. We will get you the projects. We will approve them, and we will have worked out an agreement with the client. So it really is, you'll maybe go to the organization, you'll work with them, and in the end, of August, you will submit your final project. It will be assessed by us, but it'll also be delivered to the client, and you'll also present it. So it's a great experience to really understand exactly, to bring all you've learned together into a consultancy project that will have real meaning and real impact. So I've already talked to you a lot about who this MBA is for. As I said, it's really about you. It's about your ambition, about what you want to do, how you want to go forward in your career. So I want to now just spend a bit of time and talk about the admissions process. So we are really looking for people who, have already proven themselves academically. You should have a 2.1 or above. But we're also, it is an MBA. We're really keen on seeing what kind of work experiences or related experiences that you have and you can bring to bear. You need to have a language requirement of a 6.5 or above if you're coming from a non-English speaking country, and no component less than a 6. We ideally need people who have work experience of 2 to 3 years minimum. We will take into consideration if, I spoke to someone the other day, she'd worked part-time while she was doing her degrees. She'd had some very interesting roles. So again, if you've got any questions about the work experience, please write to us, send us your CV, and we can review it and give you some feedback on whether or not we consider that sufficient to apply for this program. Then we also require a GMAT or a GRE score. Again, we're looking for really just a well-balanced score, and that's around 550. But we also will waive the GMAT score if there is a compelling reason why you cannot take it. And again, if you want a waiver, you need to write to us, send us your transcripts, your academic transcripts, along with your CV, and we'll review them. All candidates get an interview. You'll need a personal statement, of course, the CV, and 2 references, ideally one from an academic source and one from an employer. If you've been out and you've been working for quite a while, it's fine to have those as both from employers. So if you have any questions about the admissions or the admissions criteria, please reach out to us and we'd be very happy to have a chat. I often get questions about the GMAT exam. So I just want to quickly talk to you a little bit about that. You are able to take the GMAT now online. So wherever you're at, you're able to take the exam. There are also lots of opportunities to prepare for the exam. And if you just Google GMAT practice tests, you can pull up tests and start to practice them. And that is the best way to prepare. I tell candidates not to worry about the GMAT. It's just part of the application process. We look at you as a whole. We do not take one aspect and focus on it. So it's really you as a package. So, take a practice test, see how you do. I have students ask me, why do you require the GMAT exam? Well, because in this program, we need students who can really assimilate and digest lots of information very quickly, make decisions. So we want to make sure that you're got adequate preparation, that we understand who you are and where you are and where your starting point is, so that if we take you into the program, we're very committed to making sure that you can succeed. And so the GMAT just is, again, it's another piece of information in understanding you as a person. The other area I get a lot of questions is about the interview. So I find this always very interesting because I am sure that most everyone on this call, if not everyone on this call, has applied for a job. And, what did you have to do to get a job? You had to fill out an application and you had to provide them with information. That's exactly what you do when you apply for a MBA. And then, of course, you have an interview, and that's exactly what you do for an MBA. So this really shouldn't be very daunting for you. This should just be pretty much an affirmation of wanting to do this program and making sure that your expectations actually align with ours. So what are the common questions? Well, they're really like doing a job interview, right? Tell me about yourself. Why an MBA? What makes you stand out among other candidates? What can you contribute to your program? What are you expecting from this program? And those expectations are really important. We want to make sure that you have the right expectations, the right motivation, the right drivers, and that we can meet those expectations and that we're on the same page and we're aligned. And then what are your strengths and weaknesses? Of course. So as you can see, these are not difficult questions, but they're important questions. And they form the kind of last part of your application. So once we get your application, our admissions team looks through everything, makes sure that the application is there, it's been done correctly. And then from there, then we move on to setting up your interview. And the interview then will take place. So we're now just starting, by the way, in the next week to start to review applications and start to set up interviews. So if you've applied and you haven't heard from us, you'll hear from us soon. It does take, by the way, several weeks to go through the application process, both in terms of the application being reviewed by our application team, our admissions team, coming to the department, us reviewing then your application, and then setting up your interview. So do be patient with us. You will get an answer, in due time. So finally, I want to talk about scholarships and funding. We recognize that MBAs are not inexpensive, and we want to try to make this as affordable as possible. So we have established 3 very exciting scholarships, and we'll be putting up shortly another scholarship offered by a pharmaceutical company, a fully funded scholarship with a stipend. So do keep out a look for that scholarship. It should be up shortly in the next few weeks. So the scholarships and funding. Well, first of all, we have our MBA Health Future Impact Leader Scholarship. This is a fantastic scholarship. As I mentioned to you before, it's £15,000. So for someone doing the MBA, that really brings it down to essentially, for an overseas student, pretty much what you pay on an MSc. It's for really exceptional students taking the MBA Health. You should plan, you need to have already gotten into the program or be applying for the program. It'll be a deduction on your tuition. If you go to our website, it explains how to apply. We expect you to write a 500-word essay about how you're going to have impact. And depending on the number of applications, we may ask you for an interview. Then there's the Women Healthcare Leaders Scholarship. Again, this is £5,000. You can couple it with the other scholarship. They're not exclusive. What makes this one really exciting is that for people who identify as female and get this scholarship, they also have the opportunity to have extra career coaching and a development program. We're really committed to helping to create better and more senior leaders that are women. Women make up about 80% of the workforce in healthcare, but they only make up about 20% of the senior leadership. And globally, it's even more stark. It's about 5% of the leadership. So this is really our start at trying to make a difference. And then, if you're from East London, because our campus is going to be located on UCL's new UCL East campus, we have a scholarship for people who either work or live in East London that you can apply to as well. So check these out on our website. Also, UCL has other scholarships that you can apply to. There are scholarships through the British Council, through the UK. UCL's got a scholarship finder. So please, and then of course there's student loans. If you're coming from the United States, you can get a US federal loan. If you're a UK citizen, you can contact the student loan authority, and they can also assess and give you a loan. So there's lots of opportunities and ways that you can fund your MBA. And then, it's really just lastly, I just want to say a little more about the careers. We are really focused on making sure that when you come out of this program, you've got the job you want. If you're an overseas student too, by the way, you will qualify for a post-study work visa, and you can stay in the UK for up to 2 years. So there's lots of support for you and ways in which you can really interact. And then just to say, particularly for my overseas, prospective candidates, UCL is just an amazing university. There's so much going on. There's events all the time, not just in the school, but across the university. There's clubs you can join, sporting events, societies, volunteering. So being a student at UCL is just amazing. We've also got great student support and well-being team. And then London itself is just such a tremendous place to study and be a student. It's got fabulous parks and opportunities for you to free museums, galleries, festivals. No wonder it's ranked top city in the UK for students in 2021. So that's really my presentation. Just, want to highlight some upcoming events we have. Again, we've got another MBA Open Day in early Feb. If you want to know more about scholarships and funding, we've got an event on the 22nd. We've also got a great event about health innovation through capital and private equity markets with some really celebrity guests on the 22nd as well, following that event. And then we've got an upcoming events in March. So lots of opportunities to really engage with us. That's our email. If, by the way, you'd like a one-on-one consultation with myself or someone else from the MBA team, all you have to do is email us. We can set it up, and it's a great opportunity to get your questions answered, talk to someone, think about the program out loud. So again, thank you so much for your time. I'm now going to turn to the Q&A and go through these. So the first question is, hi, would you say starting an MBA right after a bachelor's degree is a good idea without any work experience? No, I wouldn't think that was a good idea, and I'll tell you why. Part of doing an MBA is really having the opportunity to reflect on yourself as a leader, to reflect on your ambitions, your work experience. If you haven't actually got any work experience, and I assume you mean that you haven't volunteered, you haven't done any part-time work or anything, you really don't have that context. And having that context is so important for an MBA. So I really would encourage you to get some work experience and maybe come back later in a few years when you can step out and really contextualize, as I said. Deba, how many hours typically is a part-time course? So Deba, I'll tell you how the part-time course works. So as I mentioned to you, it's in blocks. So if you were doing the course full-time, you do 2 blocks, 2 30-credit blocks, 1 month blocks in term 1, 2 in term 3, and then you'd have the 2 projects that you'd have to finish up in term 2 and in term 3. If you're doing it part-time, you do 1 block. You couldn't do, say, work in the morning. You come to class around 1 p.m. and finish at 6 p.m. But that would be full on for that week. And you'd have to do 1 of those blocks. So you'd have to have 4 weeks in kind of the autumn and 4 weeks in the spring. And then you would do 1 of the projects 1 year and 1 of the projects the second year. So that's how it worked. You take essentially 90 credits each year over 2 years. But it would mean that you'd have to have those blocks. So if you were trying to work around that, your employer would have to be supportive when you're doing your block, your 4 weeks, and you'd need those afternoons off work. Again, if you want to talk through that some more, just email us and we can set up a one-on-one. Ibrahim, can I ask about the expected in-campus daily hours in a full-time versus a part-time program? Are the classes usually early morning or in the evening? So as I've just explained, they are in the afternoon. So if you're taking it part-time, you'll just do 1 block per semester. If you're doing it full-time, you've got, essentially 8 weeks in term 1 and 8 weeks in term 2. So that's the real difference. So the classes aren't in the early morning and they're not in the evening. They're in the afternoon. We will, by the way, Ibrahim, be offering in 23-24 an executive MBA Health. That will be mainly online, and that will, the kind of virtual classes, as it were, will be on a Friday and a Saturday. And they'll be just each year a 1-week residential that you'll do. So you might think about doing that one if this face-to-face one, it doesn't seem right to you. How many students are you planning to accept in the first cohort? So Ashish, we're planning to take around 20 to 25 students. Excuse me. We're really looking to get a good cohort of students that we can really, have the interaction, but not too many. Anticipated age range, I'm 58 years old. Am I too old? Absolutely not. If you're up for the challenge and this excites you, I wouldn't let my age be the question. It's really thinking about what do you want to do afterwards and how will you take it forward. And again, be very happy to have a conversation with you about that. The old mall. Can IELTS be waived off if I have completed my undergraduate in English medium? You would have to contact the admissions office. I think if you're from a non-English speaking country, I believe you will have to take the IELTS. But again, if you write to the admissions team, they can get that answer for you. Ashish, housing availability for students and his family. So there is on campus housing, and there will be new housing added on UCL East. But I think if you've got a family, you would probably want to look to get something that is more appropriate. Of course, there's lots of housing options, lots of price options in London. So it's really, it's again, contacting student services. We also have an office that really supports international students. And so it'd be working with them to understand what would be the best housing option for you. Any program for spouse partners during the year? No, not in terms of this program. I mean, of course, if your spouse or partner wants to enroll in a program in London, there's lots of programs to choose from, and they might want to study alongside. Deba, thank you. All right, thank you. And again, Gamal, what's the tuition fee? So as I said before, the tuition is £45,000. It's usually paid in 3 installments across the year. If you apply to the scholarship that I mentioned to you, that's on our website for £15,000, that brings it down to £30,000, which you pay in £10,000 installments 3 times. So that's how the tuition breaks up. And then the last question I've got up here is, what is the minimum experience expected prior to joining the program? What is the employability of the program? Is there job campus availabilities? So first of all, as I mentioned, we're looking for people ideally who have had 2 to 3 years of work experience, but if you've had work experience alongside your degree, we'll take that into consideration. People who will come out of this program will have excellent employment opportunities, and we, will support you completely in meeting those expectations. There are jobs, not necessarily on campus, but we can also, there's internships, there's opportunities to work part-time. So if you're an international student, you can work up to 20 hours per week while you're doing your program. And you can work up, full-time in the off period. So there are opportunities, and many students work alongside their degree. Do you personally prefer a full-time or part-time program? I really think it's depends on you and your ability. I think, if you can afford to take the program full time, I think it makes a fabulous kind of experience, and you can really submerge yourself into the experience. But if for work and financial reasons, you need to do it part-time, I think you can still have a great experience, and there's ways in which we can help you structure your projects. So you do the Global Health Challenge in your 2nd year. That way, in the 1st year, you participate in the induction. So you get a sense of belonging and being part of a cohort. in that year. And then in the second year, you do your global health challenge. So you get to be a part of a group and experience there. So in some ways, in doing it that way, you get to know lots more people. You get to be part of 2 cohorts of the MBA rather than 1. But yeah, so I think it's really, like I said, it depends just on, you know, the life choices that you may or may not have to make to be a part of this program. And what's the email address for contact for one-on-one for further information or further discussion? So Deba, if you can just go to our website on the MBA, there's a place where you can log your interest. If you log your interest and state that you'd like to have a one-on-one meeting to discuss further the MBA, that can then be set up. Okay. All right, so I think I've just got about 7 minutes, and I'm happy to really stay here with you and answer any questions that you might have. So I'm going to give it just about 1 more minute. If there are no more questions, what is the deadline for applying? Well, like I said, we're really starting to look at applications now. So I think if you can get your application in as soon as possible, ideally before the end of March. We may end up extending the application deadline to the end of June, but I wouldn't count on it. So I try to get my application in by the end of March at the latest. And anything, again, that we can do to support you in terms of putting your application together, just, you know, put an email to us. Ashish, I don't know what the application fee is, to be honest. But if you go onto the website, it should tell you somewhere what the fee is. Expected mean salary for graduates of this program. That's a great question. Again, it's contextual on what country you're going to work on. I mean, in the United States, I know people coming out of programs like this are making about $150,000, $160,000. But again, it really depends on you. You know, if you end up going and working in the charity sector, or say the NHS, or, you know, all of that weighs heavy on the kind of program. If you go into management and consulting, you'll make more money. If you go into private healthcare, you'll make more money. So I think that's a real hard one for me to answer, because this program really attracts a wide variety of individuals. Planning to work for the NHS going forward? Well, again, I would imagine if you can come in on a management track in the NHS, that, you know, you will make, I have no idea, but you can look at the NHS job website and get an idea of just kind of the jobs and the salaries. But, you know, probably anywhere from 70 to 100,000 pounds would seem a reasonable kind of starting salary for someone out of an MBA in health that wanted to go into the NHS. Thank you for all your responses. It is an exciting new program. Thank you, Ashish. I will set up a Zoom call shortly. Thank you. All right, well, thank you. It's been a pleasure talking to you, and thank you so much for all your questions. I wish you great success, whatever you decide to do. If you apply to the program, we really look forward to meeting you and supporting you through the application process, and also, of course, joining us and being part of our community. So have a lovely evening or afternoon, wherever you are. Take care. Bye.